Hello guys, welcome to my channel. Today we are going to talk about another topic. We are going to talk about several circumstances whereby you can find that you test positive for pregnancy while you are not pregnant. 7 circumstances whereby you can find that when you do a pregnancy test, you test positive, but in this circumstance, in reality, you are not pregnant. So I made another video whereby we discussed about the 7 circumstances whereby you can test negative while you have the signs and symptoms of pregnancy. This is whereby you find that when you do a pregnancy test, you find that you are positive for pregnancy, but you are negative for pregnancy, but you are having the signs and symptoms of pregnancy. So in this video, we are going to talk about the circumstances that can make you to test positive. This is whereby you get a positive pregnancy test result while you are not pregnant. So welcome, like, share, comment, and don't forget to subscribe. And let's get started with the video of today.
I be so sick of you niggas, y'all contradicting. I be so bold myself when you come and fuck me. I feel so ordinary, except when you around me. Treat me like water while you wear me out. Arguments, you air me out. Tripping about you.
Welcome again. So the first reason why you might be testing positive for pregnancy while you're not pregnant is because of something called the chemical pregnancy. So chemical pregnancy is whereby you find that you got pregnant, fertilization occurred, and then the fertilized ovum implanted itself at the uterus, what we call the implantation. So after implantation, there was a production of the human gonadotrophin hormone, which the pregnancy test kits usually detect the presence of this hormone, and this usually tells you that you are pregnant. So this hormone was produced, but before long, you lost that baby. So the growth of the baby suddenly stops, and then you lose that baby early in the pregnancy before you even knew it. So this is the most common cause of a positive pregnancy test result. So in most circumstances, you might not notice that you are pregnant. You can only detect the presence of the chemical pregnancy when you do a pregnancy test. When you do a pregnancy test and this test turns positive, but later you find that you receive your menstrual period. So this can occur early in pregnancy, early before you even notice about it. The second cause of a positive pregnancy test result when you are not pregnant is because of something called the evaporation lines. Yes, this is evaporation line. So this is the appearance of a faint or a colorless line in the pregnancy testing kits. So the pregnancy testing kits usually have two lines. We have the control line and we have the test line. So when both of these lines are clear enough, you are sure that you are pregnant. When you're not pregnant, you'll find that the control line is the only line that will be appearing on the pregnancy testing kit. So the evaporation lines usually appear at the test the test line of the pregnancy test kit. So it appears there because of evaporation of urine. When you put the test in urine, because of the evaporation of the urine, you'll find that there will be an appearance of a faint and a colorless line at the test line of the pregnancy test kit, which you might confuse and think that maybe you are pregnant while you are not pregnant. And the number 3 cause of having a positive pregnancy test result is because of delaying in reading the pregnancy testing kit results. So mostly when you do a pregnancy test, you are required to read and interpret the results after 3 to 5 minutes. So when you delay in reading the test results after putting the test kit in urine, you need to take a period of between 3 to 5 minutes before you read the pregnancy test results. So when you delay reading this pregnancy outcome, this pregnancy test kit, maybe you did the test, but before you read the results, maybe you got an activity you went to take a shower, or you just went to your workplace, you just delayed the time between taking the test and reading the test, you will find that by the time you're going to read and interpret the results, this is whereby you will find the presence of the evaporation line, which I've just mentioned in my previous explanation. So mostly the evaporation lines usually appears when you delay in reading the pregnancy test results. And the number five thing, and then number four, here at number four, the fourth cause of you having a positive pregnancy test results while you are not pregnant is because of using fertility medications. We have some fertility medications. For those who don't know fertility medications are medications which some women use so that they can conceive or so that they can get a baby. So most of these medication usually use the human gonadotrophin hormone so that they can stimulate ovulation. Ovulation is the production of the female eggs. So most of these medications, I'll mention some in the video. Most of these medications usually utilize the human gonadotrophin hormone. And as we have said, the pregnancy test kit usually detect the presence of this hormone so that it can tell you if you are pregnant or not. So in this circumstance, it can tell you that it can turn positive because you're consuming medications which contain this human gonadotrophin hormone. We also have some over-the-counter medications which women usually, not only women, we have men who use this medication also for weight gaining or weight losing. You need to know that there are no approved medications which are used to gain weight or to lose weight. But you have some over-the-counter medications which you also utilize, or they use the they contain the human gonadotrophin hormone. So that they contain these hormones. So when you go and do a pregnancy test, when you are using these kinds of medication, the test kit will show a positive pregnancy test result. Number 5 is because of having a recent pregnancy, a miscarriage, or an abortion. So when you are pregnant and you lose a baby through a miscarriage or an abortion, most people usually confuse between miscarriage and an abortion. Most people think that an abortion is an illegal termination of a pregnancy, but that is usually not the definition of abortion. Abortion is whereby you find that you lose a baby before 20 weeks of pregnancy, while miscarriage is whereby you lose a baby after 20 weeks of pregnancy. Both of the terms refer to the losing a baby, but the difference between a miscarriage and an abortion is the time frame. One is below 20 weeks, and the other one is after 20 weeks. So when you have accidentally had an abortion or had a miscarriage, you might find that because you're pregnant and there was a production of the human gonadotrophin hormone, this human gonadotrophin hormone usually takes some time before they decline in the body to zero. Yes, this takes a period of days and many weeks after losing a pregnancy. So by the time you're going to do a pregnancy test, while you have had an abortion or while you have had a miscarriage, you will find that the test will turn positive. But this will not mean that you are pregnant, but this test will just detect the remaining or the residual human gonadotrophin hormone, which is still existing in your bloodstream or in your body after having an abortion or having a miscarriage or after having a recent pregnancy. So number 6, we have rare medical conditions. We have rare medical conditions. So this occurs very rarely. So sometimes you have some medical conditions which can produce this human gonadotrophin hormone, the HCG hormone, or they can mimic this human gonadotrophin hormone. Some of the conditions include ovarian cysts. We have some tumors and also some types of cancers which can produce this human gonadotrophin hormone, which when you do a pregnancy test, you might find that you test positive for pregnancy. Finally, we have ectopic pregnancy and molar pregnancy. So in this circumstance, you are in reality you are pregnant, but the pregnancy is not viable. For example, the first case whereby you have an ectopic pregnancy. An ectopic pregnancy is a pregnancy whereby you find that implantation did not take place in the uterus, did not take place at the exact place whereby the implantation is required to take place. So this is a high risk pregnancy because when this implantation takes place in other areas, including the oviduct, you might find that it might rupture the oviduct, which will put the health of the mother and that of the baby at risk. And this condition usually needs urgent medical care, whereby you need to seek medical advice when you have this condition, because it puts your life at risk and also puts the life of your baby at risk. In the other case, we have a molar pregnancy. Molar pregnancy is whereby you find that because of chromosomal abnormalities, as humans, we usually have 46 hormones, whereby you find that this usually comes from the sperms and the ova. The sperms produce 23 chromosomes, and the ova produces 23 chromosomes. So that sometimes because of chromosomal abnormalities, whereby you find that either you had excess chromosomes or you have a less number of chromosomes, there might be a formation of abnormal mass of cells and tissues in the uterus. So instead of the baby forming in the womb, you find that there's just abnormal tissues and cells that are growing in your womb. So this about the ectopic pregnancy and the molar pregnancies are usually, all of them are not viable, which they should not be allowed to continue with their development. So this is usually detected through having an ultrasound, which will tell you either you are having an ectopic pregnancy or you are having molar pregnancy. So I've talked about all the 7 causes, whereby the first cause we talked about the chemical pregnancy, we talked about the evaporation lines, we have discussed about the delay in reading the pregnancy test results, we have talked about fertility medications, we have talked about the recent pregnancies, miscarriages and abortions, we have talked about rare medical conditions, and we have also talked about the ectopic pregnancies and molar pregnancies. So all of these can make you to get positive pregnancy results while you are not pregnant. So without wasting more time, I've come to the end of my video. If you have any question, any concern, or any clarification, feel free to ask in the comment section below. I just want to remind you to please consider subscribing to my channel. So with that said, bye bye for now. Let's meet in my next video.